Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida. We're actually sitting in the Hauser Neck Center, and I'm here with somebody who I actually just met, so this is going to be one strange interview. As anybody knows who's contacted Caring Medical, we have a screening process of who should come in as a client. Like off-site, I think you talked to Jesse, who has a lot of experience with the office here, and some of our off-site people have been working with me for over 10 years. So they know who's a good prolotherapy and who isn't. When Jesse took your history, Ken, the history was, your back was basically good for 20 years after you had had prolotherapy, and I wasn't the one who did the prolotherapy. So part of this, I wanted to let people know there are some really good prolotherapists, around the country. So it isn't, we're not the only site that does prolotherapy. But what I wanted to show was there are people who have a chronic pain problem and they get prolotherapy, and prolotherapy can last for decades or for good, because it's a common question that we get asked. Do the effects of prolotherapy last? Like even on my cell phone, there was a practitioner out of Washington that's just learned about prolotherapy, and she was asking that. And I basically answer it this way. I say, if somebody has decent posture, they put decent amount of forces on their structure that they had like they don't go crazy, reasonable posture, and your problem was your lower back. So in other words, if somebody with a lower back problem gets comprehensive good prolotherapy, and then you take reasonable care of your back, the pain can be gone for years, decades. So why don't you just tell us your story? What kind of back problem did you have? And then you obviously saw a practitioner by where you live, and where do you live at?
Okay, we live in Apopka, Florida, which is just north of Orlando, about 7 to 10 miles. And about 30 years ago, I was having really severe back pain. So I started going to a chiropractor. I was going to a chiropractor about 3 times a week, and I was wearing a back brace at the same time. And before I could even get home, my back was out of place again. And I did this for a solid year. And by the time the year was up, pretty much, I was bedridden, basically.
Yes,
and a friend of mine told me about a doctor down in Bear Lair Bluffs, just north of St. Petersburg, that was doing something called prolotherapy. And I didn't understand what it was, but he explained to me that it was shots in the ligaments that tightened up your ligaments. And he said that he had had it and it helped him a lot. So I said, I'll try anything, because going to the chiropractor was not working. So my wife drove me down there, and I cannot remember the doctor's name. He was an older gentleman at the time and has passed away since. And he gave me a series of shots. I think it was 5, 6, 7, not shots, but
Sessions.
Sessions, there you go.
Yeah.
Sessions of shots. And I tell you, it tightened up my ligaments, and they've lasted, actually 20 years. I went 20 years with no problems whatsoever. And the type of work that I did, I really didn't take care of my back.
Oh, like what? What kind of work?
Well, I was a truck driver for a lot of years.
Okay.
And then when I sold my trucks, I worked for Loomis Fargo.
Okay.
And I handled heavy boxes of coin, bags of coin,
Huh.
and heavy.
Wow, you were
coin.
twisting and
So I was twisting and handling coin, bending over.
Wow.
And I was in my 60s then. And I ran the turnpike run, handling heavy boxes of coin all day long.
Oh, okay.
So I really didn't take good care of my back, you might say. So I didn't have good posture, but it still lasted 20 years.
Wow.
So probably if I'd have took care of my back, I might have lasted a long time.
Yeah, you wouldn't even be here, because you're obviously here because I am going to see you as a new patient.
That's right.
Yeah.
So probably about 8 years ago, I started having some minor, some minor problems. And, I would go to the chiropractor again, get it put back in place. And then probably, I'd say 5-6 years ago, it started getting a little worse.
Okay.
And I would go to the chiropractor, my back would be put back in place, but yet it would still go out, and my right side was the weakest side, and I would still have a little bit of pain. It would be put in, but it would come back out just a little bit,
Yeah.
and I'd probably have a 2 to 3 level of pain on my right side, which to me was bearable.
Gotcha.
You know, and I would
Yeah.
I would just stick with
Yeah.
it. Well, about 2 months ago, it went out again,
Okay.
and I mean it really went out,
Yeah, okay.
and it took 5 sessions for him to get it back in place enough for it to be tolerable, and that's when I really went online
Okay.
and did some research and found Caring Medical, and that's when I started getting in touch with your staff and went through the process to get here now, and thank goodness I'm going to go through the sessions again because they do work, and I'll stand by it 100%.
No, I mean, I was just thinking, like, you know, because what did you think when we contacted you? You haven't even met me, and then we said, would you do a video? Like, that's kind of, you're a very unusual person. Did you think that was kind of odd?
Well, not really. I mean, I don't mind letting people know what I've been through.
Yeah.
You know, because to me, I don't mind helping people.
That's
You
awesome.
know, I think that we're here on this earth to help each other.
Wow, that's great.
You know,
yeah, exactly.
You know, that's what my daddy taught me.
Yeah.
You know, my parents taught us to help one another.
Yeah.
You know, my daddy taught me to respect people. And how do you respect people? By helping people. You know, and I was brought up that way.
That's awesome.
You know, and I think that we need to help one another. How else are we to get on in this country, this world, but if we don't help one another?
Yeah.
You know.
That was well said.
And I believe that in my heart.
Thank you so much.
You
Wow.
know? And the way you help, I think you're when I got here and saw all the things that you do, wow. I mean, you don't do just Prolotherapy. You do a lot more than that.
But it's the same idea of well, you know how God designed the body. We're just trying to get it back
Oh,
to
yeah.
how God's originally designed it, and He designed the joints to be stable. So we're one of the places that, you know, helps people get their stability back.
Yeah. Well, the original doctor that I went to see, he told me that we're not designed to walk straight up, you know, stand up straight and
Yeah.
walk, you know, and he said that our ligaments are like rubber bands,
Yeah.
you know, and they stretch over a period of time,
Yes, sir.
you know, and that everybody's different, you know, and some will stretch quicker and faster and more than others.
Yeah.
And I figure that mine stretched a little bit quicker than more than other people's
Yeah,
do.
exactly.
So I need another set of sessions. So here I am.
I look forward to seeing you, and we just want to thank you so much for sharing your story with us.
I don't mind at all. And if any time that you want me to say anything or help anybody, I'm willing to help anytime.
Thank you so much.
You know, you're very welcome.